Hello, everyone. Welcome. I think we have some new folks who are joining us today. So every time we meet before we launch into our meeting, we ask all of us to kind of stop and take a pulse on just how we're feeling with work right now. And then to sort of address that and bring us all into the room, we'll do a mindfulness after I introduce our speaker. And then we will launch into our didactic and then switch over to case-based learning at about half the hour. So thanks in advance, everyone, for filling out that poll. Everyone who's able in a space where you're able to turn your camera on, we do love to see each other and keep developing our learning collaborative. We realize not everyone's able to do that, but thank you to those who are able to turn their cameras on. And I'll give folks maybe another minute or two to sign on before we introduce our speaker.
Just good afternoon. It's good to see some familiar and new faces. Thanks for bringing your attention and your time. We know how busy everyone is, and just appreciate you bringing your attention and your time to come together in community to do some thinking and learning and strategizing together.
Okay, well, thank you all for signing on. I want to respect everyone's time, so we'll go ahead and get started, and I will introduce our speaker today. So, we are thrilled to have one of our very own Hub team members, who some of you may know. Saun-Toy Trotter is a healer and psychotherapist who brings over 20 years of experience providing trauma-informed and culturally responsive services to adolescents and families. She has experience practicing in school-based health centers, residential treatment facilities, inpatient and psychiatric units, and private practice. As clinical director of school based behavioral health services at UCSF, Benioff Children's Hospital, Oakland, she has expanded school mental health services to include health education and youth wellness advisory boards. Ms. Trotter is a contributing author to School Social Work, Engaging Social Justice and Racial Equity from Practitioners' Perspectives. She has provided training and consultation for many child-serving organizations, including Castlemont and McClymonds High Schools, Alameda County, Missy, New York Department of Health, and Mental Health Hygiene and Huckleberry Youth Programs. She is committed to evidence-based and culturally rooted practices that foster individual and collective health, well-being, and liberation. So with that, I will turn it over.
Thank you so much, Lauren. I appreciate the introduction and again, appreciate everyone here. I think I will add to that, I am a mother of a teen ager, and then I'm also a licensed marriage family therapist. So I'm a school-based clinician, like many of you, and in the field of mental health, and been working with adolescents for over 30 years in many different domains. We're here to talk about emotional regulation, right? Which is something that we all need, we all strive for, we all work towards. I'm going to share the presentation. I want to just really appreciate Ebony Ellis, Ashlyn Davis, Tina Liu, and Stephanie Minjahar, who were actually our trainees when we developed this group, a DBT group for Black youth. And so this presentation has been updated, but I am definitely using and borrowing some of the slides from this group. And I remember when I went through an intensive training on DBT, and before that, I thought, oh, I was like, oh, I am, more of a psychodynamic creative arts therapist. And, learning DBT really learned that behavioral therapies are so crucial, especially for adolescents when their behaviors make such a difference in their lives. So I want to just invite yourself to just introduce yourself in the chat, just to say what's your name, what your pronouns. Again, I'm Saun-Toy Trotter. My pronouns are she, her, and hers. And just what's one emotion that you have felt sometime today, right? It could be this week, but just what's one emotion that you felt sometime today. Beautiful. Thank you, Patty, for getting us started, and for building community. So as we go, just again, if you could put in the chat your name, your pronouns, and what's one emotion that you felt this week. Even just maybe one emotion that you're aware of right now. Yeah, I see anger, frustration, sadness, stress, relief, empathy, gratitude, overwhelmed, stress, calm. So just all however you are right in this moment, all of your emotions are welcome. And I'm glad that you are here, right? So we all have emotions, sometimes stronger, sometimes even numbness, right? Absence of emotion can be an emotion. I invite you to take a moment. So mindfulness in the DBT is, the definition of mindfulness is, paying attention to the present moment on purpose without judgment. And what do? We observe, we describe, and fully participate. And we do it without judgment as much as possible, bringing our full attention when mindfully and as effectively as possible. And so taking a moment now, I invite you to take your eyes, I know we're on the screen, but just notice anything in your room. Take your eyes and just land on something in the room and take a moment to notice it. Like in your minds, notice the colors, the shapes, the textures, see what it might evoke in you as you're placing your eyes on something that is in the space that you're in. And just notice it, bringing it your full attention, 100%. And then I invite you, just as you continue to notice this thing in your room that you've chosen, or it could be even outside the window, just to take 3 intentional breaths, filling out your breath all the way down into your belly and allowing yourself to have a full exhale. Do that 2 more times at your own pace. And then when you're ready, coming back into the shared space. And throughout this presentation, definitely have as much choice in terms of where you want your eyes to be and where you want to focus your attention. Just to know that I don't have anything to disclose. CAP is supported by federal and state funding through HRSA and also the California Department of Healthcare Services. So our goals for this time today is one, to be able to describe, like, what is dialectic? What is DBT? So be able to describe that, to identify some goals of emotional regulation, and to begin to practice and teach some emotional regulation skills. At least for some folks, this may be an introduction. For others, you may be leading DBT groups or emotional regulation skills, or using some of the DBT handouts in your work with your clients or with patients. Want to support you to be able to coach young people to use at least 2 emotional regulation skills, and honestly, maybe even coaching ourselves, or, and thinking about, oh, right, right, right. Good reminder, good reminder. And also we want to support adolescents to reduce the vulnerability to intense emotions. So just briefly, like, I'll put in the link later a video, but this is a great video that was created by Esme Schaller, who runs our DBT clinic at UCSF. I'm not showing the whole video today, but I want to just introduce DBT is dialectical behavioral therapy. DBT is a cognitive behavioral therapy. It was developed by Dr. Marsha Linehan, and at the time developed specifically to address people who are having lots of maybe suicidal and high risk behaviors. Since then, it's been really proven to be effective in many different domains and behaviors. And one of the reasons I really see it as effective with teens and adolescents is that, again, their behaviors can have such intense consequences, right? Whether depending positive and negative. And so as a school-based therapist, really teaching young people DBT skills really gives them something in that they're going to be able to have with them for a lifetime. And even when we did the DBT group, at our school-based health clinics, young people, after the group was over, but maybe they were still in individual therapy, would still reference back to these skills, right? Like, oh, I use this skill, or this is, I'm using coping ahead, or I'm using like the distress tolerance stop skill. I invite folks who are here this week to come back next month because you're going to get a great presentation on distress tolerance skills. So that's a brief explanation of DBT. So what is a dialectic? So if I'm saying DBT is a cognitive behavioral therapy um, that integrates mindfulness and some of Buddhist principles, but also brings us into dialectical thinking. So rather than black and white or opposites, really integrating that kind of there are two things can be true at the same time, right? And really looking and searching for the synthesis. I share that I'm a parent. My son knows, right? Kind of it's like, I'm doing the best I can. And I said, and yes, what do we say? You're doing the best you can, and we can do better. That's a key DBT um, statement, right? Holding both change and acceptance. And so here are some examples, right? Like I can ask for help and I can be independent. Right? I can want my room clean, but I don't want to hang up my clothes. Um, I want to have fun, but I also want to follow my parents' rules. So take a moment and think for yourself, what's one way that you're holding the dialectic right now, or ways that, a dialectic that you are holding or that you're aware of, right? Kind of where there's maybe two opposites, but you're looking for that middle ground. You're looking for that synthesis. So just to hold some of the goals of DBT skills training, today we're focusing on emotional regulation, but is looking at kind of for young people, like what are their personal goals? What are the behaviors that they want to increase and what are behaviors that they want to decrease? Really holding that emotional regulation is really the ability to influence and control our emotions when we have them and how we experience and express them. Kind of like breathing, emotions are both automatic and there's something that we can control, that we can influence, right? So we have our automatic breath, but I can also have myself breathe deeper or breathe more rapidly, right? To kind of shift something inside myself. Just like my feelings and emotions rise naturally, but I can also influence my emotions by the story that I'm telling myself, by my behaviors, the activities. Yesterday, I know, like, I took a walk in the morning that kind of helped with some regulation and some support, right? Emotions can be consciously influenced or control or changed. And thinking about kind of dysregulation is when we're having emotions, particularly intense emotional states, and that we're unable, no matter how much we try, to like kind of change how we're having them or our experience and even our expression of them. Right. And so a lot of behaviors we see like through trauma, anxiety, kind of behaviors that show up where whether it's intense anger, sadness, where we see often this experience of having intense emotions and not being able to control them, right? And that's times many people are coming to therapy for support with that, or getting referred to therapy for support and being able to not disappear your emotions, right? But to be able to have emotions in a way where you're still feeling that you're in the driver's seat, that you have some sense of control of your actions. And so the goals of emotional regulation, right, is to be able to understand the emotions that you're experiencing. And in some of this we do in any sort of therapy session, being able to identify, name, and describe our emotions, um, to be able to reduce our vulnerability to unwanted emotions from starting the same in the first place. I often say, are you eating? Are you sleeping? Are you moving? Right. And the more that maybe we're doing some things that have us decrease our vulnerability, kind of the less I know the less we'll have maybe some of those intense, unhealthy, negative emotions, right? So how do we like really shore and resource young people, right, and ourselves, right, to reduce our vulnerability to some of those unwanted, intense emotions, and decrease the frequency of unwanted emotions, and to really stop or reduce emotional suffering or stop unwanted emotions once they start. And some of those unwanted emotions might be, the emotion of despair, the emotions of rage. And again, validating those emotions, but also really thinking about helping folks have their emotions, but also shift kind of what their behaviors are and shift some of those, especially chronic, painful emotions and feelings. So again, we want to support adolescents to take control of their emotions. This is the movie Inside Out. There's a second one coming, or maybe it's already come out. It really illustrated these emotions that we have inside. And I think the thing to hold, right, is that emotions are really important, that they are a source of wisdom and a source of information. And yet, our intense emotions can lead to problematic behaviors that impact our relationships, impact how young people are doing in school, and most importantly, impact their safety and impact their choices and opportunities, right? It can really, problematic behavior can really limit their choices. And kind of what is available to them. So again, the upside of emotions, they give us information. They communicate to influence others and motivate and prepare us for action, prepare us for what's next. And I will just add one more thing where emotions really guide us in our choices. And so emotional I want to now share like a few different, sorry, strategies for regulating our emotions. And one is check the facts. This I use all the time with clients and also with myself, right? So emotions can be a reaction to our thoughts and our interpretation of an event. And so one example that just for me this week, I was having some pain in my eye. And for a minute I was like, maybe like, is my cornea separating from my eye? Like what's happening? What's going on? And so it's like, okay, actually, let's just take a moment, check the facts, what's happening, make an appointment, like move into kind of some problem solving. Um, but, it's like rather than going to like panic or fear, I had some fear and maybe some reasonable concern. But rather than panicking, I was able to check the facts and change my interpretation of the event and then move into problem solving. So I think, for each of us taking a moment of, when we might have had a big extreme response to something initially, and then taking a moment to like kind of actually what's happening here, what's going on, and kind of what's and make a plan. Another example, I had a young person who was trying to get their driver's license, and there are some barriers that were coming up for them. And so, rather than moving to a place of like, oh, this is never going to happen, I'm not going to try it, kind of initially having these moments of intensity and just intense hopelessness, checking the facts. So, what happened? What is it you need? Did they say you can't come back or can you? But really taking some time to review what's the actual facts in the situation, which can shift someone's belief or interpretation, right? Which can actually really change the emotion. So, what's the process of checking the facts? First is like, what is the emotion that I want to change, right? Am I having panic or maybe increased, really intense sadness? Um, or it can again be intense sadness, despair, or hopelessness. So, the first step is really taking a moment to identify and label kind of what is this emotion that I'm having. Again, just to use this simple example that I shared in terms of like what was happening with my eyes, right? It's like maybe it was like some fear or panic, right? So taking a moment, like, okay. And then kind of what's the prompting event? Like what's actually happening in the situation? So really being able to describe kind of what happened to evoke the emotion and then taking a moment to see, am I interpreting this situation correctly? And inside of that, really holding, are there other possible interpretations? For those who may be doing CBITs in schools, right, there's helpful other thoughts. Again, this is part of the cognitive behavioral aspect. Kind of what's another interpretation that I can have? Like for, as I shared the driver's license example, like kind of what are other interpretations? Is it that I'm no good, I'm a failure, I'll never make it, I'll never drive, nothing ever works out for me? Or is there another opportunity? Like, oh, this was hard, but I actually can go back and take it. That other people have also not passed the test. So again, generating different expectations, taking a moment to really help young people understand black and white thinking. Like, am I thinking all or nothing, or really in extremes in this situation? I'll never, I always, they always, I never, and kind of checking some of that thinking, and even holding like, okay, what's the worst thing that could happen in this situation? And even if it was the worst thing, what are the resources that you have? And how likely is it that that worst thing would happen? Right. And then the last piece is really checking, like, does the intensity of my emotion actually um, correspond with the facts of the situation? Right. So these are some questions that you can coach young people to use when they're having a strong emotional response to a situation. One example, just seasonally, right? We're in college acceptance time, right? And so as young people are waiting, or maybe if they're getting into or not getting into some of the colleges that they chose, really holding like, what's the emotion I want to change? What's the event? Is there another possible interpretation? Am I thinking in extremes? Kind of what's the likelihood of the worst thing happening? And once you check the facts, so if, let's say that one of the places, there's two different options, is to be able to move into problem solving or opposite action. So I want to go over that with you. So once someone has checked the facts, let's say again, being able to take a moment and identify kind of, well, what is actually your goal? So maybe you're having feelings and emotions. Um, that maybe the feeling is actually really right, spot on, but perhaps the intensity of the emotion, right? Like, once you check the facts, that person's able to like, oh, actually, let me like, maybe I'm feeling disappointed or afraid that I won't pass my driver's license test again. And so what's your goal? Is to pass the test, or how do you want to feel? And so then going through some brainstorming with that young person and choosing at least one solution, and then putting that solution into action, and then coming back and evaluating the outcome, right? And so in this example that I'm using, right, so the goal is to get your driver's license, and so maybe you need to ask for help, or maybe it's, when you're taking the test, you're going to pause and take a few deep breaths, each time, every third question, right? Because perhaps it's kind of the anxiety that's getting in the way of you passing his driver's license test, right? So that's something you're going to try, you're going to put into action, and you're going to evaluate how that worked. I did have a client put in some like deep breathing techniques as they were taking the test, and then pass the test. Right. So that's one example. Um, the other thing, so check the facts. How are the feelings? Moving into problem solving, or moving into opposite action. And so I know I'm moving through these very quickly, but I definitely want to just make sure you have an introduction, and there are a lot of resources to get more information, and I invite people to do a deeper dive into each of these. So thoughts affect our feelings, and behaviors affect our behaviors. That I think many of us in this room hold. When we're having strong emotions, we may also have that can lead to strong urges, including urges to self-harm, urges for suicidal behaviors, urges to run away, to leave class. So urges that might have intense consequences. It can even be the urges to stay in my room all day and under my covers and not leave, right? So these are some of the urges that might have result of strong emotions. One thing we want to invite young people to try on is, so let's say you're having the urge to stay in your room and to never leave, is to actually, okay, that's the feeling, the urge, and try doing the absolute opposite 100%, right? Put all your action into it. So it's like, okay, you are actually going to leave your room, right? That you are going to, if your feeling is isolation, that you're actually going to call a friend and go see them. Right. And so this can be tricky, because it's like, oh, why are we doing something different than what I feel? Right. And again, this is balance of change and acceptance. Right. And really holding that for you as a clinician, but also helping the young person hold that. Right. So maybe, is this a moment where if you're feeling like isolating, it's where you wanna meet yourself is what with just some, just some validation and acceptance and compassion and radical acceptance. It's like, "Okay, I just am gonna need to isolate right now. I'm gonna give myself lots of compassion around that need or that urge." Or is it a time where it's like, actually, I'm really working towards connecting with other people? I know I've been isolating for a long time, and really, this my larger goal or my larger commitment in terms of creating this life worth living, which is also a part of DBT, is actually I'm going to actually put myself 100%, put my action towards, texting that friend, and maybe it's just it, right? Like maybe the opposite action is texting a friend, right? It doesn't have to be that you're texting the friend and going to the mall, but 100% putting your energy towards that opposite action and seeing what happens. So that is opposite action. And particularly, again, once we check the facts and the emotion doesn't really match the facts. The two more skills that we're going to go over really quickly. One is ABC, please, right? And this skill is really towards reducing the vulnerability to emotional mind, to intense emotions and consequential behaviors. And so, starting, I'm going to kind of really more focus on the A, which is really accumulating positive experiences. And this is a great exercise you can do with young people, any young people. You can do it with yourself, you can do it with your family. Just make a list of like what are positive things that you enjoy, or that you used to enjoy, right? So if someone is kind of more in a depressive state, right, it's like I don't enjoy is not, but like what are some of the things that you used to enjoy? Is it playing basketball? Is it roller skating? Is it listening to music? Make a list. Is it uh trying to think of things. Is it dancing? Is it making art, right? Is it creating robotics, right? So making a full list of things that that person enjoys, and then maybe making a goal that like, oh, I'm going to do one or two of those things this week. There's also kind of building some mastery and skill, kind of going, and then planning and coping ahead. So let's say something's happening in the future. Um, that young person, I have a test that is coming up and I'm feeling super anxious and stressed about it. So, what are two or three things that you can do to plan ahead for that test or that exam, or even kind of to plan ahead for that meeting at the mall with a friend because now you've gotten to that place? So, these are some ways to kind of reduce. And it goes with please, which I really want to, as I was reviewing this, just invite all of us to this is kind of to use the please skills as much as we can, which is treating physical illness, balance eating. So eating as healthy a meal as possible, eating 3 times a day, eating a balance of fruits and vegetables and protein and carbs, right? Avoiding mood altering drugs. So really reducing. So maybe harm reduction, like yes, maybe working with the folks to really think about their use, and especially when they're in more vulnerable places. So you've had a lot of suicidal thoughts this week. Can we kind of reduce your vulnerability? Is there a way to really reduce? Can you make some commitments to reducing your use? Um, Getting enough sleep. So, sleep hygiene and supporting people to have rest can be another way of reducing someone's vulnerability, and getting exercise. And these are things that I think, this day and age, like everyone knows, like this is good, but it can really take some planning, detailed planning and strategizing with someone to figure out, okay, so how are you going to get sleep? Oh, I'm going to put my phone, in a drawer. Or I'm going to set an alarm for 10 o'clock as a sleep alarm, especially with the time changes, right? But really planning specifically for these things, going to medical appointments, getting things treated. These are some ways to reduce vulnerabilities. So, the last emotional regulation skill that I want to share with you all today is again, our emotions is riding the wave, but holding that, our emotions are wisdom, take and bringing in some mindfulness. So, when we're having an emotion of anger, frustration, sorrow, taking a moment to observe them, to label it, to name it, and know that the intensity of our emotions only lasts for a period of time. And I talk to young people about like we can feed them. It's like we can feed a fire, we can feed our emotions, we can get it bigger and bigger and bigger. We can be on social media and have all the interactions and have all the text. That's gonna like make that wave continue to ride. But really, if we practice some more mindfulness, know that it's going to have some intensity and it's going to recede. we can actually just label it, notice it where we're feeling it in our bodies. Remember that we are not our emotion. Again, creating some distance between the emotion and the I and the self, that we don't have to act on our feelings. So it's like, yes, I really have this intense feeling. I want to run away. I want to leave. So like, yeah, that's an incredibly valid feeling. So can you feel it and not act on it? Can you feel it and talk to someone that you trust? Is there a time when you felt something differently? I promise you, this is a great skill to use in your relationships, with your spouses or your children, right? Like having these intense emotions, remembering when you felt differently and just allowing the wave, the emotion to rise and to fall, and really radically accepting and not judging yourself. Right? This is emotion. It's going to come, it's going to go. So, lots of quick information about emotional regulation skills. Two great resources: DBT skills in schools is one with Dr. Maza and team. This is an incredible resource, especially in terms of bringing dialectical behavioral therapy and some of the regulation, the DBT skills to young people in schools. And of course, the DBT skills training manual, and anything that the Linehan team has to offer. So thank you. And I look forward to hearing kind of your thoughts and questions and how you all are using these skills or what kind of stood out for you. So I'll pass it back to Lauren.
Amazing. Thank you, Saun-Toy. So we do have a couple moments for quick question and answer or sharing of thoughts before we move into our case-based learning. I do welcome at this point everyone who's able to turn your cameras on so we can move into our more interactive part of the echo this afternoon. My goodness. Any quick thoughts, questions, and then we also do have some of our hub teams stay on at the top of the hour for about 10-15 minutes if folks have longer questions, more targeted questions, or even want to practice any of the skills or how you would introduce the skills with the people you work with. So I see a quick question from Suzanne Frank. Suzanne, Saun-Toy, do you do DBT as a group?
Yes, we have led DBT groups in our school-based health clinics, both in person and virtual.
And I know UCSF has a young adult and an adolescent clinic where they do groups, multifamily groups as well. And I did put that link of the video in the chat.
Do schools offer this? And if so, how do I find out from our local school if they offer it?
Some schools do offer DBT skills groups. I don't know right now what district you are, where you are, and kind of how to find that out. So I would need more information to kind of understand that. But schools can offer DBT groups or therapy or school-based behavioral health providers. I would say I mean, I have found it extremely effective and that young people really like it, right? So that's the thing that it really, that they like it, that they use it, that they reference back to it, that they may teach their family members about it. I'm curious if anybody here on the call has facilitated or led any DBT skills group, or even just as you're hearing about the skills, like, is there any part in there that you're like, oh yeah, this would be helpful for me and or my clients or patients that I work with?
I see. What's the minimum age you find this useful for? I believe the DBT clinic at UCSF goes down to 12, but in terms of even applying the skills, do you have thoughts on Toy?
Our clinic is also 12 to 21.
I'll tell you, I use some of the skills like breathing, riding the wave, ABC, please. Like you said, are you sleeping? Are you eating? Are you active with my 3-year-old? Right? So I think you can really adapt these skills that aren't necessarily rocket science. They're like Saun-Toy said, they're all things we kind of know are good, and you can adapt them with who you're working with. And Petra, I'll turn it to you before we go into case-based learning.
Yeah, I think responding also to the question, Suzanne, about concurrent DBT group for parents. And I guess, I mean, there's a whole continuum of DBT skills and a DBT kind of orientation that I really love that Saun-Toy spoke to about, we're all doing the best that we can, and we need to try harder to do better. And holding that dialectic is applicable, I think, in all aspects of life, no matter how old you are and no matter what's going on for you clinically or otherwise. And then there are DBT treatment groups, but I think, we can be using these principles and individual skills in all kinds of different ways. And I guess the one other thing I just wanted to say is that kids who have been through more intensive treatments where they've had DBT imposed on them, because that was part of the structure of the inpatient program that they were in, or residential program, they may not have the most positive orientation around DBT because they felt like they were kind of forced into it. So I don't always make that really explicit. I just use the skills, sometimes without naming them. If I know that, a youth has been through a program like that and may not feel great about it. But the key is like just being able to embrace, the individual skills in whatever setting or capacity. Thanks.
Thank
Thanks,
you,
thank
Petra, for adding that. And I think one last thing I'll add is that when we facilitated DBT groups, we also provided, we created a DBT group for Black youth. We created a DBT group in Espanol, really in creating, kind of making some culturally specific DBT groups for young people and integrating cultural practices inside of the groups and images, and really put in a lot around destigmatizing mental health by bringing in like celebrities who talk about mental health kind of into the group and into the curriculum of the group.